Welcome to this session on academics at UNMICRC Institute, and in this session we are discussing a very important publication. This was presented at the 75th Cardiological Society of India presentation at Kolkata, and this was basically one of the largest consensus statement that was published on the sidelines of the abstracts as well, and also presented as an oral paper. This was authored by myself from representing our institute and state, and the other authors were Dr. Rajiv Agrawal from Meerut, Dr. Soumitra Kumar from Kolkata, Dr. John Christopher from Hyderabad, Dr. Tom Devasya from Manipal, Dr. Bhargav from Udaipur, Dr. V.T. Shah from Mumbai, Dr. K.P. Suresh Kumar from Chennai, Dr. Sunny Banerjee from Kolkata, and Dr. Sanjay Porwal from Belgaum. So apart from these, this basically was a consensus statement for the CV Inoca. That's a research on coronary vasodilator which was published as a consensus statement. This was basically a consensus about the perspective and insight from the Indian clinicians at the forefront of clinical cardiology. And this study was hence presented as a consensus for the same. So basically this was to establish a comprehensive consensus statement on management of Inoca. What is Inoca? Basically is ischemia of normal non-obstructive coronary artery disease. So in patients who present with angina but don't have an obstructive lesion and it's been documented ischemia, those kind of patients need to be provided therapy which needs to have incorporating contemporary evidence from the valuable real-world experiences of Indian physicians and cardiologists. So we very well know that these kind of disciples and disorders, the Inoca kind of management, the strategy remains very wide. You have multiple anti-anginals apart from the beta blockers and antiplatelet and P2Y12 inhibitor and statins which have been used. Apart from symptomatic management, there are a lot of drugs that are available for managing angina in a patient with Inocas, and for them what should be the line of therapy, it remains a very gray area, and hence this consensus statement in the CV Inoca was trying to establish the guidelines from the Indian perspective, because we know that the Indians behave very differently from their Caucasian counterpart. So why this research? The management of ischemia of non-obstructive coronary artery involves a very personalized medicine approach, taking into account the specific endotype, including whether it's a microvascular angina or a vasospastic angina or a mixture of the same. Even European Association of Percutaneous Coronary Intervention, EAPCI, and European Society Cardiology Working Group on Coronary Pathophysiology Micro-Revascularization recommends a diagnostic approach which includes an interventional diagnostic procedure, which is a coronary angiogram, that needs to differentiate the two apart from the other methodology of assessing as to what we are dealing with in Inoca. So this stratified medical therapy can lead to a reduced symptom burden and improved quality of life. And hence the long-term vasodilatory therapy, including use of nicorandil, though has been touted as beneficial, especially in patients with recurrent angina and episodes, especially those who cannot tolerate beta blockers. A lot of patients in our part of the world have COPD, respiratory disorders, bradycardia, heart failure, arrhythmias or bradyarrhythmias, peripheral vascular disorder, which may be relative contraindication or absolute contraindication to use as beta blocker in these group of patients. So the decision to initiate such therapy should be based on multidisciplinary approach, which includes non-invasive, invasive procedure, particularly in case of persistent and refractory angina. So it's important to note that Inoca is not a benign condition. It is associated with increased incidence of CV events, including hospitalization, quality life and healthcare costs, and hence it's important to incorporate appropriate management strategies for Inoca to improve patient outcomes, and there is not enough evidence. So how the study was conducted? Basically this was a multicentric study with the experience of inclusion of at least 10 years of dedicated clinical practicing cardiologists were included. There were representative participants from 2 to 3 districts on an average. So geography was widespread across India, and based on the representative sample across the country with proportionate distribution across the zone, the sample size was calculated. At least one published index journal was inclusion criteria for all those who were coming to the consensus board. The contribution as a faculty in a dedicated cardiology forum, and their research representation in international peer-reviewed forum was mandatory for these patients to be, these experts to be included to derive and be part of the consensus statement. So methodology and the statistical background was basically based on a virtual collaborative educational initiative which was convened on August 23 through a series of 8 nationwide virtual interactive meetings. at the forefront of coronary care. So this was called a CV Inoca consensus group. The cumulative clinical experience of these 300 cardiologists was 4,000 man-years who rated their level of agreement for 8 questions with each of them on a 5-point Likert scale, and this was preceded by a contemporary evidence-based discussion on the updates of coronary vasodilators. Weighted mean of Likert scale was then calculated and consensus was predefined as a score more than 100. GraphPad 10.02 and ANOVA was used for statistical analysis for the study. The sub-analysis and the validation and analysis was based on the validity of questionnaire involving systemic process across the questionnaire being reliable, valid and appropriate by the group. A meeting among the experts, which included cardiologists, researchers and statisticians, was used to review the questionnaire based on the expertise, experience and diversity of the perspective. Questionnaires discussed, explaining the rationale behind each section and question was discussed, and discussion was of any conflicting opinions and work towards a consensus on changes or the improvements as needed was discussed. Statistician discussed the questionnaire construct, validity, reliability and potential statistical analysis. The analysis was done into 3 fragments of individual analysis, comparative analysis and segmental analysis. So the individual analysis assessed the weighted score for each statement to understand specific perspective, while comparative analysis compared score across different segments to identify patterns and contrast in perception, while segment analysis analyzed how perceptions vary. So these are the results. These were the 8 questions. As you can see, the consensus score more than 100 was considered to be significant. As you can see in the random order, the score was 100 for each one of them, but it was most weighted for question number 6, which is contemporary clinical practice should incorporate a broader management paradigm for stable CAD, then better align with the underlying cause of angina and ischemia. And the highest score aggregated was for that of agree of 84 with the weighted mean being of 121.6. The lowest was for the 102 for question number 4, the newly updated guidelines on the management of patients with coronary choricity for the advanced from the advanced country like US are relevant to Indian scenario for the benefit of Nicorandil. So you can see that most of the consensus in this meeting was though agreeing that it can be incorporated, but a lot of people felt that the Indian guidelines need to be drafted separately as compared, and we cannot adopt the US guideline straight away out of the book. The other questions were emerging therapies such as coronary sinus reducer, CD34 stem cell therapy, novel pharmacological agents are promising advances for treating coronary microvascular dysfunction. Nicorandil with its dual mechanism of action was more effective in treating angina with normal coronaries. Given in unique mechanism of action, potential of cardiomyocyte protection, Nicorandil is superior choice for long-term management. Adopting a mechanism-specific management approach can enhance the prognosis of Inoca. Contemporary clinical practice should incorporate broader paradigm for stable CAD. Nicorandil is among the most appropriate choices compared to other options like CCB and nitrates, and diagnosis informed by coronary function testing significantly improves the healthcare experiences and emotional well-being of women diagnosed with Inoca. So the highest mean scores with the 2 standard deviation in 95 percentile percent of confidence interval for the consensus were for agree of 81.8 plus minus 7.7, followed by strongly agree, which was 26.9 plus minus 7.9, with a range of 75.3 to 88.3 and 20.3 to 33.5 for them respectively. So the highest agreement, as I said, was for the contemporary clinical practice should adopt a broader management approach for stable CAD, better aligned with the underlying cause, and coronary function testing enhances well-being for women who are diagnosed with Inoca. So gender-centric approach was also proposed. Nicorandil with dual action of mechanism of action is effective for angina in patients with normal coronary and a preferred choice over CCB nitrates, and unique action for cardiac myocyte protection, making it superior long-term, were the 3rd, 4th and 5th. The latest US guidelines for chronic CCS relevant to Indian scenario though was statistically significant but weighted the least amongst the 8 questionnaire. So as I mentioned, these were the 8 questions with based on score of 121.6, 120.7, 119.8, 117.5, 109, 108 and 102 respectively. So what's new? The conclusion is this consensus initiative highlights the unanimous agreement among Indian clinicians on the crucial role of comprehensive management of Inoca, emphasizing the need of Nicorandil and aligning their contemporary evidence and practice. It is the first consensus for Inoca for Indian perspective that's ever been conducted, and the evidence of US guideline further and strengthens its significance in the Indian cardiology care with regards to the same. These were the papers and the referencing for the same. As you can see, there is also the paper on Inoca on the management, and then there are papers from the EAPCI guidelines and the expert consensus which formed the basis for the same. So basically this was the first meeting of ever consenting out, creating a uniform statement across the board, and this very likely we will be able to publish in one of the reputed peer-reviewed journals for it to come out as a consensus statement which stresses upon the individualized approach, differentiating different types of Inoca, not just neglecting all chest pains based on clubbing them into a single subgroup of disorders, but also to emphasize that the therapies that need to be included vary from Nicorandil to beta blockers to other agents, and Nicorandil forms a very important basis for managing patients with Inoca. So this is the CV Inoca paper which was presented at Cardiological Society, its 75th Platinum Jubilee session by myself representing our institute as a consensus statement in the oral novel research presentation. Thank you very much, and if there are questions, we'll be pleased to answer them. You can write to us. Thank you. Take care. Bye-bye.